Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institute. Today we are going to see how should we do reading part A. So I'm taking one of the readings for today and this is the reading and I have not done this reading. But from the far end, what I can see as I can see the first thing that normally there are 7 questions in the reading part A, the first 7 questions in which you have to write only A, B, C, D. I don't know which institute has created this question paper, or maybe it is original OET site, but I'm very thankful to them because again, Dr. BKM takes responsibility of only telling you how to do your reading and listening easily. So we do not create question papers. We are thankful to the institute which has created this question paper. And considering the point now again, please try to understand these small things. So what is happening is, first of all, I will read these questions. So in real exam, there would be 7 questions. You just have to write A, B, C, D, that in which paragraph it is. So now I will tell you the technique, how to do that. So first I read and I try to underline the words. So age-related considerations for initial treatment of burn injuries. So my main word is age-related. Initial treatment of burns. So initial word is important, burn injuries and age related. Second thing, say the risk involved in certain treatments. What are the risks? When to start thinking about specialist treatment options. When to start. So timing about specialist treatment options. So this is about treatment options. This is about risk. This is about age related. Treatment informed by the patient self-assessment. So self-assessment, how to categorize the severity of the burn. So these are the questions I have got. So I have read the questions well. So there would be 7 questions in the exam like this. I just need to write A, B, C, D. So what I'm going to do, I'm going to go to above part. So what I do now is just to skim and scan just from the outer area. Like I will not go in the depth. I will just see burn death. Burn injuries are classified according to how much tissue, superficial, partial, thick burns, fullness, thick burns, mixed depth burns. So what I can understand, there was a question about the classification, how to categorize the severity. So I would like to do this option as an A because it was asking about the categorize of severity. So I think that should be the categories: full thick burns, mixed thick burns. So it is only from the outer thing, superficial thing, that I could do fifth question as A. Then it says fluid resuscitation, suggested regimen for fluid resuscitation, adults, children. So now it is talking about age. So most probably my age related question should be B. So age related considerations, adults and childhood. So it should be B. That is how easy it is when you do not panic. Then it can be wrong as well. I'm not quite sure. Then it talks about resuscitation, this, then burn surface area. If the burn area is over 50% or adult 10%, so it is talking about children and adult only. Management of burns. Management means treatment of burns. So assess the patient, airway, cooling, assess the burn, pain control, immunization, debridement, blisters, application of antibiotics, suitable dressing. So there was question something to the risk involved, when to start thinking about specialist treatment performed by patient self-assessment. So patient self-assessment is not here. Risk, are there any kind of risk over here? No, I cannot see any risk. So now these are difficult questions. So out of the 7 questions, I would like to do 3 and 4. But over here, I have got only 5 questions. So still I would like to find one more question. If the risk involved, are there any risk word? Risk word should be very common word. Ah, should be guided by individual case, patient management. Nah, it doesn't say anything. Patient score elicited from the patient. So this is patient self elicited from the patient. Again, it is from the top. Again, I don't have to go to depth. Patient score elicited from the patient. So patient self-assessment means now the fourth answer should be this D. Fourth answer. So I have done these easy question. Now this is what is the main thing that is required to control your temperament, that you have done 3 questions out of 5 and 2 questions would be difficult. So please try to find the word risk, otherwise leave this thing. If risk word is there, then I would try to find it, otherwise I will leave it. So risk word I cannot find. Mhm. Risk word now. No, no. So this is wastage of time because I know these are difficult questions. So I should leave it. Now I will leave this question. So leaving the question is the most important time management skill. But I always will remember I have left this question of risk, and when to start thinking about specialist word, I can maybe find pediatric analgesic guidelines. So pediatric means specialist, I guess. So I would do this option as an D as well. Yeah. So I will do this D as well. So I will do this thing as D, the specialist wala. If I do not find anything, I will make this guesswork. Specialist word is meeting with the pediatric word, pediatric surgeon or pediatric analgesia guidelines. So that word somehow is matching. So I will do this D. Again, many questions can be wrong, but I will not waste my time. So this is the most important time management skill. Classification of the burn injuries depend on. Now see your mind. Please see your mind. Now I know classification must be in the part A. So that is where you are saving at least 5 seconds in every question, because now your mind is operating that you have to see in which part. So even this classification of burn injury depends upon the amount of dash caused. So I think it should be in part A. So that is what is saving my time. So this is the time saving technique. I will go to the part A. Depends on how much tissue damage are classified according to how much tissue damage. So I think tissue damage is the word that is good enough. So if I try to fit in this word, so classification of the burn injury depends upon amount of the tissue damage caused. That is what I think should be my, but this is not an easy reading, but still I would try to do it. So tissue damage is the word. How much? So how much means severity of the tissue damage. Now I will take to the next thing. So the next question. So that is how I will keep on doing questions in my exam and will keep on saving time. Patient recovering from the third degree burns are likely to experience a great deal of shrinkage and dash of their skin. So my keywords is skin. My keywords is third degree burns. Third degree burns, I'm just trying to find here third degree burns, but it is the management part, it should not be there. So I should go into third degree burns. So this is third degree burns. Extend into subcutaneous. This I need the word skin. Skin. Remaining skin can be dry and white or black with no blisters. Healing associated with contraction and scarring. So now I will try to fill the word. So that is how my mind will go. Third, are likely to great experience of contraction means shrinkage. This is a difficult exam. Normally, these are very simple, but contraction means shrinkage and scarring. So scarring should be my answer as per me. So I am just, so the main time is saved that where is the question. So now I will do the next question. Eighth, when evaluating mixed depth burns, you should take into account how much burn looks and whether there is dash in the affected area. So mixed depth ones, the main keywords are mixed depth burns, and you should take into account how the burn looks and whether there is dash in the affected area. So mixed depth burns. So this is my another word. These are the keywords. I'm keeping on scrolling, keeping on trying. So mixed depth burns. These are the mixed depth burns. The clinician should estimate the average depth by the appearance and the presence of sensation. Resuscitation should be based on the total days, and local treatment should be based on burn thickness at any specific time. So what is my blank? Is it easy or difficult? When evaluating means you should take into account how much and whether there is dash in the affected area. While even whether there is dash in the affected area. Mixed depth, estimate the average depth by the appearance and the presence of sensation. So I think sensation should be the word, because burns are, this is a difficult question. Again, if you are unable to find this question, leave it. Again, I'm telling you, this question was also difficult because contraction word was replaced by shrinkage. So in the exam, the questions would be much easy. This exam is difficult, and also I have told you 7 questions will be A, B, C, D. But again, there is presence of sensation. Now I will try to fit in this word. So how the burn looks and whether there is presence of sensation in the affected area. I think that should fit in. Whether there is presence of sensation in the affected area. I think because I'm also using this word estimate. Estimate means evaluating. So that is why I'm doing this as an answer. Mixed depth burns should estimate means evaluate. And also clinician word should be there, I guess. While evaluating mixed depth burns, you should take into account how the burn and whether there is presence of sensation or sensation in the affected area. That should be answer as per me. But this is again, I'm telling you, the reading is going to be easier than this in the exam. You should cool burn injuries by taking off any dash or jewelry that the patient is wearing. So that should be in the management part. So what is saving my time? Hot clothing. So this is the simplest one I have done until now. So cooling, all the keywords are here. So jewelry or hot clothing. Remove jewelry and hot clothing. This was the easiest one I have done. Take off any hot clothing or jewelry. So this was the easy one. When cooling the wound, make sure that you do not put the patient at risk of. So again, the same place. So what is saving my time is where exactly it is. Cool the wound, not the patient, taking care not to cause hypothermia. Not to cause hyperthermia. So what's my blank? When cooling off, make sure that patient at the risk of hypothermia. So these prepositions are very off word. So I'm just gonna read this word again for you. Off word, off. But over here it is given other ways. Try not to cause hypothermia. That means there is a risk of hypothermia. Again, I'm telling you, this question paper is little difficult. In exam, there would be 4 questions like these. The questions that is much easier gonna be than this one. This is only like 4 or 5 questions would be of such kind where the words are shuffled. Otherwise, prepositions will help. In this question, preposition did not help, but I could see cool the wound, note the patient, taking care of, not to cause hypothermia. So I think hypothermia should be the answer. Then I go to, you should consider the patient may require a. A word is also very important. So articles, a and the, prepositions of these words are great help when it comes to OET reading part A. So the patient may require a dash booster depending on when they were last immunized. So there was something about immunization. I could see immunization was somewhere around here, I guess. Immunization word I definitely read. Immunization, there was a very, it was very, yeah, check immunization status and update tetanus if necessary. So immunization word was there only. And over here, immunization word was not there. So yeah, that's the only word we have. Now I will go to, the patient may require a dash booster depending upon when they were last immunized. So tetanus word is the only word I could see. Tetanus is the only word I could see. And update tetanus. Update tetanus means if necessary. Again, this is a difficult question. So tetanus is the only word I can fit in. And there is no other word. I think immunization is not given anywhere else, just to make sure. No. So that's the only point. So tetanus, I cannot write anything else. Tetanus booster, I guess. So again, going to question number, you should apply ointments containing dash to all deeper burns. Again, it would be in the treatment part. Again, that is what is saving my time. I know it would be either in C or in D. So that is what is saving my time. You should apply ointment containing dash to all deeper burns. So deeper burns are, that was in the classification, I think, deeper burns. And ointment words, recommended analgesia, this and this. Endo immediate oxidone, endone 2 to 4 hours. Is this the ointment or any ointment word? Ointment words, opioids. So this deeper burns, but deeper word is not there. Deeper words, deeper burns. So there were these deep partial thickness, full thickness, mixed depth burns. Is there any treatment? Our local treatment should be based on the burn thickness. at any specific site. So any ointment, nah, any ointment, superficial and partial thickness burns. Half of this volume is nah. So that is the only point I can see the deeper burns. So it's this only, I guess, but it is on the basis of pain. It does not say so. This is the question that is actually wasting my time. So let us save our time. And I think either it can be a poets or endone. I'm not quite sure because ointment word I cannot find. So maybe in hurry I'm unable to find. So I would leave this question. So that is again time saving strategy. But you will definitely do this question. You will not spare this question because OET has not got any negative marking. But you will save your time. So you should apply ointments containing dash to all deepers. Containing means there should be something in it. Containing words I can do. Containing codeine, but it is not given as ointment. That is what is protein word should be like. That is where I am unable to control myself at the moment because I am trying to do every question right, which again will waste your time. So you have to go ahead. I have to leave this question. I'm really sorry. So I will go to question number 14. So that is where I am saving my time. If I get stuck on question number 13, my exam is gone. And you will see 19/20th question should be comparatively. If I do these two questions for you, what route should be used to administer ibuprofen to children? I'm just leaving some questions. So in part A, the last 2 or 3 questions would always be easy. So pediatric, ibuprofen, oral route, oral route. So that is, see, it's an easy question. Again, I will tell you what route should be used to administer ibuprofen to the children. So pediatric, analgesia, ibuprofen, orally. So oral route. So that is an easy question. But if I do not reach to this question because I kept on wasting my time on 13th question, my exam would be gone. So that is the main technique, to leave the questions which you are unable to find. This question can be wrong later on, but deeper burns again. But it should be in air, I guess, the deeper burns. Deeper burns, deeper burns. See, non-superficial burns. That is application of antibiotics in the form of ointment. So here is my answer. Should always be used to prevent in non-superficial. Again, I'm saying only 3 or 4 questions would be this way. This is a little difficult reading. So non-superficial burns means deeper burns, application of ointments. Now antibiotics. So obviously my 13th answer that I will find later on containing antibiotics. So now this question is also right because I left it for some time, and that is where my mind gets a chance to redo it. But if I am stuck on that part, exam is gone. So this is the main technique I want to tell you. So this I have done. After how long should a patient's pain relief regime should be reevaluated? After how long? So I need the timing. Review in 72 hours. Review in 72 hours. After 72 hours or after 3 days. 72 hours is a better word to be written. And it is also given analgesia should be reviewed after 72 hours. That is what they are asking. Analgesia word is also given. Patient's pain relief regime. Pain relief regime means analgesia. So these 2 questions were very easy. But if you get stuck on this 13th question and you reach up to this question and you leave 2 easy questions because of this difficult question, your exam is gone. So that is what is the main technique to control your anxiety, to control your nerves when it is the right time. And this paper is again little tricky as compared to what will come in the exam. And there would be 7 questions in which you will have to fill A, B, C, D. Don't do all the 7 questions. There would be like 4. This is the main technique. 4 or 5 questions would be easy. Do only those 4 or 5 questions. You would not find 2 questions easily, but they will give you 7 questions to waste your time. If somebody will do all the 7 questions, that means that person has wasted around 5 minutes. This is not right. Only do these questions on the basis of whether it is given in age related assessment, that is B. Risk involved, I think, should be C. When to start thinking about specialists, that is, I think, D. Pediatric wala, it was D, that was pediatric. And then when to start thinking treatment self-assessment, that is 100% self-assessment, 100% D. And pediatric word can be here as well, a specialist treatment. No, it's not there, no specialist. So it is only, it should be D only. That's the only thing. And then how to categorize the severity should be A, and that is how I do my easy questions. So one question risk wala is little difficult. I don't know where it is given the risk word, but I am unable to find it. So that is what will waste my time. So at last, if I will do C by fluke or by guesswork, let's see. So I'm just going to check out the answer, what I have done, and will take your help as well if you can help me, because you guys would have done this reading in the class. So I would like to ask you what I have done wrong. First question, did I do B? B, C, D, D, A?
Yes, sir. Yes, sir. Yes.
So almost every question was right, right?
Yes, sir. Yes.
Then sixth question, let's see. Well, tissue damage, wow. Scaring, wow. Sensation, wow. Hot clothing, perfect. Hypothermia, tetanus, blisters, antibiotics. And then I do orally and 72 hours. So it's all good. So you can well understand how to do it. So this is Dr. Bhupesh talking about how to do your reading part A in detail. Please save your time. Don't get stuck on difficult questions. Mind would operate that way out of anxiety. Oh, I cannot leave this question. I have to score 20 in part A. Oh, my teacher told me part A is easy. I have to do all these 20 questions. No, you will find 16 questions easily. 16 questions, especially in the first 7 questions, one or two will surely be difficult to waste your time. So please save your time. Only do 5 questions out of the first 7 questions. And now I don't know why I tell you so many times, guys. And still, if I ask you someday, so you will say, oh, sir, I start my reading from 8th question. No, guys, you have to start your reading from first question. Out of the 7 questions, you have to do at least 4 or 5 questions. Why? Because it will give you that satisfaction that you have done first 7 questions. But if you start from the 8th question, one thing you miss is that you will always at the back of the mind, you will say, oh, I have not done my 7 questions. I have to do it. Second thing, the major thing, if you will realize the way I have done reading, that in the 8th question, you will not know in which paragraph it is given. That is where I was saving my 5 seconds in each question. If I save my 5 seconds in 15 questions, so that makes around 75 seconds. That makes around 1.5 minutes. Just about 1.5 minutes, little less than 1.5 minutes. So that 1 minute you can well understand a reading of 15 minutes, saving your 1.5 to 2 minutes. How big this deal is. So please, when you do even 8th, 9th, 10th question, have this in the mentality that this question has more chances in the part A. This question has the more chances in the text D. This question has more. This will save your time. So this is the main technique of saving, and always start from first question. So these two things are very important. Please subscribe our channel if you have not. This is Dr. Bhupesh from Dr. BKM Institutes at your service, assuring you for the best of the best techniques to pass your OET reading and OET listening. Thank you.